C is not the only health system expected to have a vaccine soon. Hundreds of other healthcare workers are also expecting this shot of hope. And joining us now with how it will be rolled out is medical reporter Liz Bonas at Good Samaritan Hospital. What is happening out there, Liz?
Hey, Paula, good evening. As you say, we have waited a long time for this day. What a privilege to work with this crew and to get to this day. As you mentioned, UC got it first, but the rest of us, at least in the other hospitals, expect to get it in the next couple of weeks, probably, believe it or not, with the Moderna vaccine. As you know, the FDA is scheduled to meet on Thursday to give emergency use authorization perhaps to that vaccine. It will come in much like the Pfizer vaccine did in all likelihood. We do have some video earlier today from the Ohio State Wexner Medical Center. We've been telling you that Operation Warp Speed actually contracted with UPS and FedEx to get this where it needs to go. The vaccine then goes to a pharmacist. It gets mixed with a solution, so you get it about to room temperature. And then for Pfizer, you have to about 6 hours before you have to actually put that vaccine into an arm to give it to somebody to get the best effect and to get this started so that we can at least maybe in some way get back to normal. Joining me right now is Dr. Kevin Joseph here. He is with the Chief Medical Officer here with TriHealth. And I know you are ready to roll this out to your employees. Give me a couple of the steps that you're actually going to be doing here.
Absolutely. It's very exciting, not only for TriHealth and all team members that interact with COVID on a daily basis, but also for the community. Hopefully it's the beginning of the end. So Ohio is supposed to get several 100,000 dosages, but that has to cover the whole state. The first individuals to get it are healthcare providers because we're at such great risk of contracting it. So we're supposed to get at the end of the month about 3,000 dosages. However, just between physicians and nurses, we have almost 5,000 individuals. That does not include respiratory therapy, in pharmacy, and physical therapy. And so we're not going to have enough dosages for the first round. So we've split up all the team members, 13,000, into about 5 or 6 different groups, depending on the priority of who's interacting with COVID patients the most.
You know, and that completely makes sense because we've heard it's viral load, meaning you're going to end up getting, exposed to it in a certain way. So 2 things people have asked me: how are you going to track who gets one shot so you make sure they get another one?
Absolutely. So once they get scheduled for the first vaccination, because it is scheduled, it's not a walk-up for many different reasons, then at the time of the first shot, we schedule them for the second shot. And there will also be reminders sent out to make sure they do get that second shot. Second shot is just as important as the first one. It's actually perhaps more important to get that longevity in a working vaccination.
All right, Dr. Kevin Joseph, thank you for joining us here. One of the things that he pointed out to me is that they're tracking every dose. And people have said to me, how do I know if something goes wrong, that it isn't the vaccine? And that dose they can actually trace back to make sure they know what you were given. And that's really important as we learn more. We're going to continue to answer your questions throughout the week. I know this team is going to be here with us. Thank you for what you've been doing throughout this thing just tirelessly. We are so grateful to you.
My pleasure. Thank you, Liz.
All right.